about telehealth and all of the implications that it has as a nurse practitioner. We are going to be diving into the specifics. So, what is telehealth and how did it start? Then we'll go to platforms and EHRs. We'll talk about the home and office environments, the standards of care, any provisions for emergency care with telehealth, and risks related to telehealth. So, things like access, secure communication, privacy, and confidentiality. So, first, what is telehealth? Well, it is the use of electronic information and communication technology to provide healthcare services to a patient remotely. And it involves a variety of health promotion and healthcare activities. So, what are some telehealth services that you can think of? Well, I'm thinking of things like remote patient monitoring, so blood pressure monitoring, home INR or glucose monitoring, things like that, telehealth mental health counseling, health education webinars, e prescriptions, and of course, patient portal communication. And while telehealth has been available for decades, its use was really catapulted by the COVID-19 pandemic in 2020. With COVID, there has been extra funding and grants to increase access to care and, of course, continuity of care. And this is especially important in rural areas and for people with certain conditions that make traveling to appointments difficult, such as mobility restrictions. So, we have telemedicine, which is the use of two-way electronic audiovisual communication to deliver clinical assessment and healthcare services remotely to patients. And so, an example of telemedicine within telehealth could be things like virtual visits, remote consultations like dermatology, cardiology, psychiatry. And this can occur between healthcare facilities at different locations or direct from provider to patient at home. Then we have live conferencing, which we call like synchronous or at the same time communication, because these are virtual visits that occur in real time. And healthcare providers would converse with patients as they would during a private in person evaluation using a telephone or a video conferencing platform or even just messaging services. And these types of telehealth visits are typically for medical history reviews, follow up evaluations, and providing treatment for non emergency health problems. Next up, we have collaboration, right? Because healthcare providers can communicate with each other remotely via telehealth technology, which improves the level of care they're able to provide to patients. And many telehealth platforms have instant messaging tools, which can eliminate missed calls and facilitate a smoother, more efficient workflow. We talked about remote patient monitoring as a type of telehealth. So, from basic health information, including those vital signs and weight for a patient who was recently discharged from the hospital, to a more complex pacemaker and heart failure monitoring, healthcare providers have the ability to review patients' progress and monitor health status from home. Then we have what we call store and forward or asynchronous communication, which is a different aspect of telehealth. So this refers to the storage of medical data like test results, vital signs, lab reports, medical documents, even imaging results. And these can then be electronically shared with the patient or another healthcare provider or vice versa. And then lastly, let's talk about medical imaging because sharing imaging, whether they are x rays, CT scans, MRIs, this can be completed digitally thanks to the interoperability of many telehealth platforms. So the ability to share images does vary between facilities, but ultimately it allows for patients to have imaging completed locally while obtaining expert consultation from a specialist further away from home, and this can really save valuable time and effort. So let's talk about some platforms in the EHR. A platform is the software or digital service that hosts the tools and technology for healthcare providers to deliver medical services remotely using telecommunication. So, key features of telehealth platforms include video consultation, remote monitoring, e prescribing, patient portals, and interoperability with other platforms in EHRs, right? All things we just talked about. And there are a wide variety of telehealth platforms. Many are web based or applications or apps that can be downloaded on secure devices. And telehealth platforms must comply with HIPAA regulations for privacy and confidentiality. Now, EHRs, right, are secure electronic hubs that encompass not only the digital patient chart, but also offer comprehensive data collection and tools that facilitate sharing information across health systems. Now, telehealth services can be offered in a variety of environments, right? So we have settings like clinic to home, from one clinic to another clinic, from one home to another home, and even a clinic to a community or a community health center. Now, wherever you are conducting a telehealth visit from, there are a few important details to look for when choosing a space that will allow for clear, open, and caring communication. We want to look for a quiet space with minimal or no distractions, a private location, right? We want to have secure and high speed internet and adequate lighting if performing telemedicine virtual visits. When working from home, an office, or clinical setting, it's important to treat a telehealth visit as you would any other in person visit, right? We want to dress professionally, wear what you would when seeing patients in person, and wear identification if you have it available. And we want to be engaged, so look directly at the camera to stimulate direct eye contact with the patient if possible. And be prepared. If you have documents or reports ready to review with the patient, have them ready or in front of you before starting the visit. And of course, abide by HIPAA regulations with telehealth visits and communication as you would in person. So close the door before the visit begins, create that private space. An alternative is the use of headphones to limit others from listening in. The use of anti glare or privacy filters over screen monitors can also limit what others passing by can see if only a semi private location is available. And then ask the patient if they are comfortable proceeding with the visit if there is anyone else present in the room, and identify those who are present. And then communicate with patients by messaging via patient portal, protected work email, or other secure communication applications. This not only ensures privacy and protection of their personal health information, but it protects your personal information like your cell phone number, their personal email, and helps maintain personal boundaries. Again, with telehealth, we maintain the same standards of care as in person visits. There are some nuances, right, like with any new skill, but conducting telehealth visits becomes smoother with practice. So, some standards here. Before logging in to start the telehealth visit, patient demographics are confirmed, including location, right? And the nurse practitioner must be licensed in the state that the patient lives or is receiving care. Want to introduce yourself and confirm the patient's identity. Confirm the patient has the level of privacy they are comfortable with. If consent was not previously obtained, explain the risks and the limitations of telehealth visits before proceeding, and document that consent was given to continue. When conducting a virtual exam, we kind of have to get creative sometimes, and this also will depend on the patient's level of comfort and ability. We can listen and observe, right? Make note of breathing effort, skin color, abnormal movements, behavior, and mood just by looking with our eyes. Use slow, clear, and direct instructions to have patients change position or bring a body part into view. Telehealth visits are less appropriate for some certain situations like health concerns that require a procedure, eye, dental, abdominal, and gynecological concerns. Any situation where a physical exam would change the medical recommendation, and of course, they're not the best for multiple complex health concerns. Now, when ending the visit, set up any referrals that are needed, provide a plan for the patient, and review instructions or any last minute questions. Send notes to the patient in a form of an after visit summary with a list of medication changes if applicable, just like you would in person, and send orders for any imaging or follow up appointments. Now, accessibility applies to telehealth encounters just as they do for in person visits. The Americans with Disabilities Act, or ADA, and Section 504 of the Rehabilitation Act requires that healthcare providers must provide auxiliary aids and services when needed for individuals with disabilities. So, what are some examples of this? Well, enabling speech to text translator on a video conference call for a deaf or hearing impaired individual, or teleconferencing with a medical sign language interpreter. For non English speaking individuals, conferencing a medical interpreter may be necessary for the telehealth visit if an in person medical interpreter is not available. For health discussions, it is mandatory and best practice to use a medical interpreter. They are certified and they have ongoing education on language proficiency, medical terminology, ethics, confidentiality, and of course, interpretation techniques. Now, one of the risks with telehealth encounters is that patients are seen outside the safety zone and the control of the clinic or the office. Now, emergency situations can range from acute stroke to an MI or myocardial infarction, a mental health crisis, or even an overdose. So, at the beginning of each telehealth visit, confirm the patient's exact location, their full address, as well as the name and phone number for their emergency contact person in the event that 911 must be activated. And alternatively, ask the patient the local emergency numbers for that location, such as EMS, police, or the fire department. And think of situations that would lead to putting an emergency plan into action. You are going to want to create a protocol for initiating the emergency action plan with yourself, your practice, or your clinic. And now, lastly, let's talk about risks related to telehealth. Access is, of course, always one of those limitations. Although the reach of telehealth has expanded, there are still disparities in access to telehealth and telecommunication among rural populations, older adults, and those with low or no income to afford devices and internet access. And digital literacy and lack of training in health information technology among patients also poses a barrier to access. Even with internet connectivity, the patient's internet quality and speed can cause interruptions or freeze during telehealth audio or audio video calls. And coverage for telecommunication is another barrier to access. Certain payers or insurance companies offer similar rates to cover telephone visits as a replacement for video visits. We have secure communication risks. Data breaches remain a risk with telecommunication. So we want to be using updated anti malware and antivirus software and make sure that audio and video calls are conducted with a secure Wi Fi and over telehealth platforms that are HIPAA compliant. And many of these platforms actually require a two factor identification verification process in order to log in for added security. And along the same line, we have concerns with privacy and confidentiality, right? Privacy refers to the patient's right to control who can access their personal health information and how it's used or shared. So we have some vulnerable populations, such as those living in skilled nursing facilities, adolescents, right? Anywhere where they may lack a private space, making it difficult to share sensitive health information, right? It might be tough for an adolescent to discuss contraception methods over telehealth if their parents are in the room next door. Or video conferencing may inadvertently expose an individual's living conditions to the provider on the screen. Remember, privacy means a patient has the right to control what information they want to share. So we can provide patients with tips to find a private location or make the encounter more private with the use of headphones or using a private room at a friend's house. If the patient is unable to find a private space, the NP can suggest rescheduling the appointment or using secure messaging through the patient portal or secure email instead. And then confidentiality is the patient's right to keep their personal health information private. It creates legal and ethical responsibilities for medical professionals to safeguard patients' sensitive information. So, for this, we want to avoid using public computers or devices tied to a public workspace or network. We want to avoid using work devices for telehealth visits, as some workplace devices and networks can track activity, keystrokes, and even website history. We want to update our security software and make sure encryption tools are turned on when possible. We want to use two factor identification when possible, and inform patients that if they are suspicious of a link, to contact the healthcare provider immediately. Often, telehealth appointments are accessed via a secure link that is emailed or sent directly to the patient's phone. Patients may always contact their healthcare provider to ask if the link sent is valid before actually clicking that link. All right, everybody, that finishes out this lecture on telehealth and all of the implications. I'll see you in the next one.